Every 40 seconds, someone on this planet has a stroke. By the time you finish watching the next 60 seconds of this video, another brain will have been hit. But here's what nobody tells you clearly enough. A huge number of those strokes were announced in advance. The brain sent warning signals hours or even days earlier. Small episodes that felt strange for a moment, then disappeared. And most people talked themselves out of taking them seriously. In some cases, the difference between a brief warning and a permanent stroke was literally 2 millimeters inside a blood vessel. If you are over 60 and you have ever felt a sudden moment of blurry vision in one eye, unexplained numbness on one side, or a dizzy spell that came out of nowhere, this conversation is for you. Welcome to the Stronger Seniors podcast. I am Dr. Daniel Brooks, and joining me today is Dr. William Carter, a physician with 33 years of experience helping older adults protect their brain health, their circulation, and their long-term independence. Dr. Carter, most people over 60 believe that stroke simply happens without warning. But in your decades of clinical experience, what have you actually seen?
Daniel, that belief is one of the most dangerous misconceptions I encounter. Because the truth is, the brain almost always tries to warn us first. The problem is that those warnings are brief, they feel minor, and then they disappear. So people dismiss them. And that 72-hour window after the first warning, which is often the only real chance to prevent a major stroke, gets wasted completely. That is exactly what we are going to talk about today. And I want every person watching right now to understand something very clearly. Stroke is not a lightning bolt from a clear sky. In most cases, it is the final step of a process that has been building quietly inside the blood vessels for years. The brain tries to warn you. The tragedy is that most people do not recognize the warning until it is too late.
Dr. Carter, before we get into the warning signs, can you quickly explain what actually happens inside the brain during a stroke in plain language that our viewers can really picture?
Absolutely. Think of your brain as the most demanding tenant in your body. It weighs about 3 pounds, roughly 2% of your total body weight, but it consumes 20% of the oxygen you breathe and 25% of all the glucose in your blood every single second. It never clocks out. Now, when a blood vessel supplying part of that brain gets blocked, even for 4 to 6 minutes, brain cells in that zone begin dying permanently. That is why doctors say time is brain. Every minute of delay costs real, irreversible tissue.
So, when doctors talk about a TIA, a transient ischemic attack, as a warning before a major stroke, you mentioned something called a 72-hour window. And I have heard you say this window is where the real story either begins or ends for a patient. What exactly happens during those 72 hours?
That window is everything, Daniel. Research, published by the American Stroke Association, has consistently shown that the risk of a full stroke is highest in the 72 hours immediately following a TIA. We are talking about a temporary blockage that resolves on its own, usually within 30 seconds to 10 minutes. The symptoms come, they feel strange, and then they disappear. And right there is the dangerous moment, because the person feels fine again and decides it was nothing. But inside that blood vessel, the conditions that cause the blockage have not changed at all. I once had a patient, a retired contractor named Gerald, 74 years old, from Nashville. He had 3 brief episodes of blurry vision in his left eye over 1 week. Each one lasted maybe a minute, then cleared completely. He told his wife it was probably just eye strain from too much television. And I always say, Gerald, if only the television had been the problem. 4 days later, Gerald was in the emergency room with a major ischemic stroke affecting his left side. When we reviewed his history, those 3 vision episodes were textbook TIA warnings. That 72-hour window had been opened 3 times. And each time, it quietly closed.
That story is a powerful reminder of how much is at stake. And it leads perfectly into what I know our viewers are waiting to hear. Dr. Carter, you mentioned there are 5 specific warning signals the brain sends before a major stroke. And you told me before we started today that the very first one is something millions of people over 60 have already experienced and written off as completely harmless. What is that first signal?
The first warning sign is something doctors have a specific Latin name for, amaurosis fugax, which simply means fleeting blindness. You are going about your day, and suddenly one eye goes dark. Not both eyes. Just one, like someone pulled a dark curtain down over that eye. It lasts maybe 30 seconds, maybe a minute. Then it clears completely. And most people blame it on standing up too fast or staring at a screen too long.
Dr. Carter, you mentioned that this one eye blackout is far more dangerous than it appears, and that the location of the blockage explains exactly why. Can you walk us through what is actually happening inside that blood vessel at that moment?
What is happening is this. A tiny clot or fragment of plaque has broken off from the wall of your carotid artery in the neck, traveled upward, and briefly blocked the artery that feeds the retina of that eye. Now here is the part that should make every person pay attention. That artery to your eye is a direct branch of the internal carotid artery, the same vessel that feeds your brain. That same clot, 2 millimeters in a different direction, goes into a brain artery instead of the eye artery. And instead of 30 seconds of darkened vision, you are looking at permanent paralysis or permanent loss of speech. Neurologists treat the phrase amaurosis fugax like a fire alarm, because it often is one.
That is sobering. Now, the second warning sign involves sensation, and you told me before we started that most people confuse this one with something completely ordinary that happens to almost everyone. What is that second signal, and how do you tell the difference?
The second signal is sudden numbness or tingling on one side of the body. One arm, one hand, half the face, or the entire left or right side at once. It comes out of nowhere while you are sitting quietly, walking, or even mid-conversation. And yes, almost everyone has woken up with a numb arm from sleeping in a funny position. I always tell my patients, if you have to ask whether you rolled onto your arm, you probably did. But a TIA numbness is different. It has nothing to do with your position. It arrives when you are already moving, already upright. And the key word is one-sided. Because each hemisphere of your brain controls sensation on the opposite side of the body. When one side suddenly goes numb without any physical reason, that is, your brain losing blood supply to the area that maps sensation from that side. It is not your arm that has a problem. It is your brain. And that one-sided pattern is something doctors look for immediately. Because bilateral symptoms, both sides at once, usually point somewhere else entirely. But one side, appearing without warning, that gets our full attention right away.
Dr. Carter, the third warning sign involves balance, and you described it in a way I have never forgotten. You said it looks like something most people only associate with a Saturday night gone wrong. What exactly does this warning sign look and feel like?
I call it the drunk walk without the drinks. You are on a completely flat, familiar surface, maybe your own kitchen floor. And suddenly your foot lands in the wrong place. Your leg feels rubbery. You veer sideways into the counter, or a violent spinning sensation hits you out of nowhere, even though your head never moved. The part of your brain responsible for balance and smooth movement is called the cerebellum. It sits low at the back of the skull and gets its blood supply through arteries that run up through the bones of your neck. When those arteries briefly lose flow, the cerebellum essentially glitches, and you stagger like you have had 3 drinks before breakfast. The key difference from ordinary dizziness is this. Benign dizziness usually has a clear trigger. Rolling over in bed, turning your head quickly, an inner ear condition you already know about. But spontaneous, intense dizziness combined with any difficulty walking straight, that combination needs a vascular explanation, not a pillow and a glass of water.
That distinction is critical. Now, the fourth warning sign is one that I know worries a lot of our viewers because it involves something we all notice as we get older. But Dr. Carter, you told me there is a very specific difference between normal age-related forgetfulness and what the brain does when it is actually running out of blood supply. What is that difference, and why does it matter so much?
This is so important to get right, Daniel, because unnecessary fear does nobody any good. Occasionally forgetting your neighbor's name or temporarily losing the word for something you use every day, that is normal. That is your brain being human, not your brain being in danger. What neurologists watch for is something categorically different. A sudden, dramatic breakdown in speech that even the person experiencing it recognizes as deeply wrong. There are 2 speech areas in the brain, both typically in the left hemisphere. One helps you form and produce words. When that area loses blood flow, you know exactly what you want to say, but the words either will not come out or they come out scrambled and slurred. The other area helps you understand language and organize your thoughts into coherent sentences. When that zone is affected, a person may speak fluently but say complete nonsense and may not understand simple phrases directed at them. If either of those things happens suddenly, and then resolve within minutes, that is a TIA until proven otherwise. And I always tell patients the same thing. If your speech alarm goes off, even for 2 minutes, even if it stops on its own, you do not just go back to your coffee. You pick up the phone.
Dr. Carter, the fifth warning sign is the one you told me surprises patients the most because it involves something visible on the skin, something many people have had for years, without ever connecting it to their brain or their blood vessels. What is that fifth signal?
The fifth signal involves a combination that doctors take seriously when they appear together. The skin condition called vitiligo, those patches of pale or white skin where pigment cells have stopped working, combined with new, unusually intense headaches that feel different from anything the person has experienced before. Now, vitiligo by itself is not a stroke warning. Many people have it their entire lives without any vascular issue. But vitiligo is an autoimmune condition. The immune system has gone off target and is attacking the body's own cells. And when that autoimmune process is active, it often does not stay limited to pigment cells. It can quietly inflame the inner lining of blood vessels at the same time. That lining, called the endothelium, is what keeps blood flowing smoothly. When it becomes inflamed and damaged, it turns into a rough surface where cholesterol and platelets begin sticking and building up over time. If you have had vitiligo for years and suddenly develop headaches that feel new and different, that combination deserves a proper vascular evaluation, not a wait-and-see approach.
That connection between the immune system and blood vessel damage is something most people never hear about. But, Dr. Carter, you mentioned before we started today that there is one common behavior that millions of people over 60 do every single night that is silently accelerating damage inside their arteries while they sleep. What is that behavior?
Chronically elevated blood sugar. And I want to be very precise here because this is where one of the biggest myths in stroke prevention lives. Many people believe that if their cholesterol numbers look reasonable, their arteries are safe. That is not the full picture. The endothelium, that smooth inner lining of your blood vessels, needs a constant supply of insulin to function properly. When blood sugar stays elevated over months and years, even at levels that have not yet been officially labeled diabetes, those endothelial cells begin to starve and deteriorate. They lose their shape. They peel away, and what is left behind is a rough, scarred surface. Think of a brand new non-stick pan. When the coating is perfect, nothing sticks. The moment you scratch it, everything clings and burns. A study published in the journal Stroke by the American Heart Association in 2022 confirmed that even mild prediabetes, blood sugar only slightly above normal, is associated with significantly accelerated endothelial damage and increased stroke risk years before a clinical diagnosis is ever made. And here is the part that keeps me up at night, as a physician. Most people in that pre-diabetic range have absolutely no idea they are there.
And that leads to something you explained to me that completely changed how I think about nighttime and stroke risk. Most people assume strokes happen during the day under stress or exertion. But you told me the most dangerous window is actually when the body is supposed to be at rest. Why?
Because blood pressure naturally drops 15 to 20% during sleep. That is completely normal physiology, not a disease. But consider what happens inside a person who already has a significant plaque narrowing one of their brain arteries. Think of that artery like a water pipe that someone has squeezed in the middle. As long as enough pressure is pushing through the system, some blood still gets past that narrow point. But the moment overall pressure drops, flow through that narrowed segment can fall to almost nothing, especially if a small clot has formed on that plaque during the day and is just sitting there waiting. That is why some people go to bed feeling perfectly fine and are found in the morning unable to speak or move. The stroke did not happen because of stress or exertion. It happened in the quiet, when the body lowered its own pressure and the narrowed vessel simply could not compensate.
Dr. Carter, given everything we have covered, if someone watching right now recognizes even one of these 5 warning signs from their own recent experience, what are the 3 specific tests you would recommend they ask their doctor about? And why those 3 in particular?
The first is a carotid duplex ultrasound. This is a specialized imaging test that looks at both the structure of the carotid arteries in your neck and the actual flow of blood through them. A standard ultrasound shows anatomy. The duplex version shows whether blood is speeding up and becoming turbulent at a narrowed point, which tells us the narrowing is severe enough to actually impair flow. When a carotid artery is narrowed by more than roughly 70% by plaque, the question is no longer if a stroke will happen. It becomes when, if nothing changes. That single test can identify a problem that a surgery called carotid endarterectomy can fix before the stroke ever occurs. And that surgery, which sounds dramatic, is today a routine procedure that saves tens of thousands of Americans from stroke every single year.
That first test makes complete sense. Now, the second test you mentioned involves blood sugar, but not the standard fasting glucose test that most people get at their annual physical. You said there is a more revealing test that catches something the regular test misses entirely. What is it?
It is called glycated hemoglobin, or HbA1c. Ordinary hemoglobin is the protein in your red blood cells that carries oxygen. When blood sugar stays elevated, glucose molecules attach to that hemoglobin and stay there for the life of the red blood cell, about 3 months. So this test reflects your average blood sugar over the past 3 months, not just one morning snapshot. You cannot game a good HbA1c result by eating well the day before the blood draw. The cutoffs are straightforward. Below 5.7% is normal. Between 5.7 and 6.4% is pre-diabetes. At 6.5% or above, we are typically talking about diabetes. If you have never had this test, or it has been several years, that is a very reasonable conversation to have with your doctor today.
2 powerful tests. Now, the third one involves the heart, and you described it as the test that catches what you called the hidden rhythm thief that causes some of the most devastating strokes doctors see. What is that third test?
Holter monitoring. A 24-hour continuous heart rhythm recording. Instead of the standard 10 to 20 second electrocardiogram done in a clinic, you wear a small device for a full day while going about your normal life. The reason this matters so much is a condition called atrial fibrillation, or AFib. In a fib, the upper chambers of the heart stop beating in a coordinated rhythm and instead quiver chaotically, sometimes at rates of 300 to 400 contractions per minute. Blood does not empty smoothly from those chambers. It churns and swirls. And in that swirling blood, clots form very easily. Those clots can shoot out of the heart, travel directly to the brain, and block a major artery. The strokes caused by AFib tend to be among the most severe we see. And here is what makes Holter monitoring so critical. Many people with a fib feel nothing dramatic. At most, an occasional flutter they blame on caffeine or a stressful day. A 10-second clinic ECG will miss an episode that only occurs twice in 24 hours. The Holter catches it. And once AFib is identified, anticoagulant medications, when properly prescribed and monitored, can reduce stroke risk in these patients by 60 to 70%. That is not an inevitable outcome. That is a manageable risk.
3 tests, each looking at a different piece of the puzzle. Dr. Carter, for someone who has already experienced one of those 5 warning signs, even briefly, even weeks ago, what is the single most important thing they should do in the next 72 hours that most people fail to do?
Write it down, right now, today. In plain language. What happened? Which part of the body was affected? How long it lasted? And what you were doing when it started. Do not rely on memory. When you sit in front of a doctor a week from now, memory softens the details. A written description keeps it accurate. Then bring that written account to your doctor and ask directly whether you should be evaluated for transient ischemic attacks and whether carotid ultrasound, HbA1c, and Holter monitoring are appropriate in your case. I have seen that one piece of paper change the entire direction of a patient's care. And I have also seen people who waited, told themselves it was probably nothing, and came back to me 6 months later in a very different condition. Do not be that person. You now know what those warnings look like. Use that knowledge.
Dr. Carter, before we close today, let us quickly walk through all 5 warning signs one final time so our viewers can carry them with them after this conversation ends.
Absolutely. The first is sudden temporary blindness in one eye. A dark curtain that appears and disappears within seconds to a minute. Never write that off. The second is sudden one-sided numbness or tingling, appearing without any physical reason while you are already moving or at rest. The third is a sudden loss of balance or coordination, what I described as a drunk walk without the drinks, combined with intense dizziness that arrives without warning. The fourth is a sudden, dramatic breakdown in speech, either producing or understanding words, that resolves on its own within minutes. And the fifth is the combination of a known autoimmune condition like vitiligo, together with new, unusually intense headaches that feel categorically different from your normal pattern. Any one of these, appearing for the first time, even briefly, even if it resolves completely, is a reason to contact a doctor within hours, not days, hours.
Dr. Carter, you have spent 33 years in this field. If you could leave every person watching today with one final thought about stroke prevention, what would it be?
Stroke is not fate. It is not simply something that happens to some people and not others. In the vast majority of cases, it is the predictable endpoint of a process that gave warnings, offered windows, and waited for someone to act. The brain is extraordinarily resilient, but it is not infinitely patient. Every one of those 5 signals we discussed today is the brain asking for help in the only language it has. Learn to hear it, because the people who hear it and act on it are the ones who get to keep everything that matters: their independence, their memory, their voice, their ability to hold the people they love.
That is a message worth sharing with every person you care about. If today's conversation gave you something useful, please give this video a like. It takes 1 second and it helps this information reach more people who need it. Drop a comment below and tell us where you are watching from today. We have viewers joining us from all across the country, and we love hearing from you. And if you want to be notified every time Dr. Carter and I sit down for a new conversation, hit that subscribe button and the notification bell so you never miss an episode of the Stronger Seniors podcast. Now, before we say goodbye today, I want to leave you with something a little different. Because keeping your mind sharp and active every single day is just as important as protecting your heart and your brain from stroke. So here is your health knowledge challenge for today. Think about it, share your answer in the comments, and see what others think too. Here is your question. We talked today about a 72-hour window after a TIA. But can you tell us, out of the 3 tests Dr. Carter recommended, which one is the only test that can detect a dangerous problem happening inside your heart, not your arteries, and can reduce stroke risk by up to 70% when the condition it finds is treated correctly? Drop your answer below. No pressure, no grades. Just good thinking between people who take their health seriously. We are honored to be part of your health journey. This channel is for educational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider before making health-related decisions. We will see you in the next episode.